Hello, my dear friends. Dr. Rajiv here, your ENT faculty, and I have got Dr. Ayushi with me from SMS Jaipur. And the good news is that she has cracked 69 rank in INI CET November 2024 examination. Ayushi, first of all, congratulations for that.
Thank you, sir.
Yeah. So, Ayushi, this session would be for the future aspirants, and that there is a very important tool for the preparation of any exam of NEET PG preparation or INICT is the grand test. So
Yes, sir.
we always have this question in our mind: how people study and that they score such a wonderful rank. If I'm a future
Yes.
aspirant, I would like to see that what did Ayushi do differently during preparatory phase that such a rank is possible in INICT, which is a really a competitive examination. And we want to take the journey further. How do people perform differently in the real exam? So even that insight would be helpful for the future aspirants who will be watching the session to understand that when you read theory, that is data, like collection. When you revise theory, that is data processing. But when you do the MCQ, that's the real data application.
Yes,
And
sir.
data application is different science altogether. We all know that. So let us see that science live happening live in front of us. Uh, when Dr. Ayushi will attempt this grand test, certain choices she will rule out with certain logic. Certain things she would really lay more focus on to solve that question. How a stem of your question, like which is 10-liner question or 6-liner question, how to read that question, which part to be read first, what points are important for that particular topic to crack that question. Because at the end of the day, we must understand that the real exam feeling is different from what we are doing in the Q bank, and Ayushi would agree with you. The
Yes, sir.
questions designed in the real exam are not perfect. They're not
Hmm.
perfect. People want perfect questions, but unfortunately, the reality is not that. The reality is questions are little hazy, little vague, and definitely imperfect, most of them. But you have to make sense out of those questions, and that's why Grand Test at Doctorals, they get wonderful feedbacks from the students also. They're almost similar to the real exam being conducted. So, because we also know we cannot make ideal question with the ideal choices. Aisha, you must have felt in November 2024, question was sounding simple, but choices were very close. Did
Yes,
you feel
sir.
that, Aisha? Yeah.
Yes, sir.
Yeah.
So your thought needs to align with the examiner's thought mindset, and that comes
Exactly.
just with MCQ practice, nothing else.
This is a unique tool we are bringing first time in the history of the NEET PG preparation examination tools. When we see an outperformer like Ayushi approaching the grand test, we can master this 20th subject. What is 20th subject? 19 subjects are the core curriculum. 20th subject is how to solve the paper, how to attempt the question. That's a separate science altogether. Let us take this session where we see Ayushi solving GT to master our 20th science, which is the solving or the art of solving the multiple choice question in the real grand test in a similar manner. And let me tell you, at the end of the test, we'll definitely analyze the paper also. What was the logic? What was asked? What would we think? And so that the whole process is a unique learning experience for all of you. Actually, good luck for the GT. Every
Thank you, sir.
exam gives you some butterflies. I know that,
Yes.
whatever it may be. So like freely float, and I'm sure the listeners to you later on would be definitely benefit by this session. Good luck for the session.
Thank you, sir.
I'll take your leave here.
I cannot access GT12. Okay, so I don't know the answer to this question, but I think we'll see it later. तो मेरी strategy यही होती है जो मुझे नहीं आता. I'll just skip it and go to the next question. So it's procalcitonin, not CRP, it's not ESR. These are very non-specific. Procalcitonin. So Southern blot technique is for DNA. We need to identify the correct statement. So this question is wrong because Southern blot is not for RNA, it's for DNA. Northern blot is for RNA, so this option is wrong. During electrophoresis, small fragments move faster. So yeah, the answer should be option B. I don't know about this thing, but ruling out ACT answer should be B. Okay, so in rice, I think E is elevation, not examination. I am not sure, but A, B, and D option seem correct. Okay, so we need to identify substance which inhibit primary active transport. So omeprazole, the answer is clear. It inhibits proton pump, which is a primary active transport. Okay, so it's a classical history of TB, and we can see granulomas in the picture. I'm looking for interferon gamma in the option which is not visible. Okay, so we'll mark for review, then come back. Okay, so A option is incorrect. It's female, whom onset is earlier. Option D is incorrect. Option C seems correct because hypothyroidism can be a cause of pubertal delay. And option B doesn't seem correct because pubertal delay can not necessarily be accompanied by short stature. Okay, so it's bicarbonate with its secretion increases by stimulation of a certain hormone. It's probably secretin, and the pancreas secretin. It's the small intestine that secretes secretin. Yeah, it's the small intestine. Okay, so syndenim scoria is the clear answer, and we need to focus on knot because in exam we tend to miss knots. So yeah, syndenim scoria is a manifestation of rheumatoid rheumatic fever. I am not sure about this question, so I'll skip it for now. Okay, so I am not sure about the answer, but seeing the elevated levels of interferon gamma IL-6 after undergoing chemotherapy, it looks like it's cytokine release syndrome. So I'll go with that. So a 2-month-old infant is brought to the hospital emergency with marked respiratory distress. Okay, so it's a 2-month-old infant. So this disorder has presented in the infancy. On examination, the infant has cyanosis and bilateral crepitations, and the liver span is enlarged. Repeated episode of fever, cough, and respiratory distress, and there is a ejection systolic murmur in left parasternal area, and there is plethora. So in it, TOF is ruled out because we won't have plethora in TOF. It's oligemia. It can be TGA because we have plethora in TGA. I don't think there's anything like congenital methemoglobinemia. So yeah, it looks like it's transfusion of great arteries. It matches with the age of onset. It matches with the X-ray findings. Yeah. A 31-year-old male has weakness in muscle and headache. So yeah, it's probably hypokalemia. His blood pressure is 190 by 110 and pulse rate at just a sec. Yeah, his BP is increased and the serum potassium is low, and there is high renin activity. Yeah, so it's probably a tumor which is secreting renin, which is increasing the aldosterone level. So it cannot be pheochromocytoma because there would be an increased level of catecholamines. It has nothing to do with the adrenal, with the aldosterone levels. It can be excessive hypertension, but it won't have higher renin levels. It is a JG cell tumor. A male comes with chief complaint of painful vesicular and pustular eruption in the distribution of sensory nerves. He gave a history of chickenpox at 10 years of age. So it's basically reactivation of chickenpox. So yeah, I'll go with herpes zoster. In the following image, two spheres have identical surface tension. They are not limited by surfactant. If the clamp is opened, what would be the consequence? We'll do this question later. Photophobia, blurred vision, burning and itching of eyes, I think chiliosis points to riboflavin deficiency. Yeah. A 39-year-old man presents for a health checkup, during which the doctor finds that he is reluctant to talk about his illness. He is suspicious that the information will be used to harm him. So yeah, it sounds like a paranoid personality. He does not trust his family either for the same reason, and he bears grudges. So it's paranoid personality, seeing the clues that he's reluctant to talk about his illness and is suspicious about others. The relaxant effect of vecuronium on the neuromuscular system is augmented by adding a volatile anesthetic agent to nitrous oxide, opioid anesthetic, because uh, we'll do this question later. So it's yeah, hemophilia A. That means deficiency of factor 8. Factor 8 concentrate would be best. A patient was planned for surgery in the distal ureter by retroperitoneal approach, and an incision is done for open surgery and shown below. What is the name of incision? Oh, it happened. Yeah. So it's not Kocher's incision. I am not sure about this question, so I'll skip it. A female comes with painless intermittent hematuria. Many of her family members also report the same. Her renal function is found to be normal and she undergoes a kidney biopsy with diffuse thinning of glomerular. So yeah, it doesn't have any other symptoms with normal urine output along with the family history points towards a diagnosis of benign familial hematuria. Okay, so in compartment syndrome, they're asking about compartment syndrome. What is the most sensitive clinical finding of compartment syndrome? So it's 30 mm, which is the pressure. I think the most sensitive and the earliest feature is severe pain on passive stretch. Pulselessness is a late feature. Okay, in emergency ward, a thoracic surgery and an open thoracotomy is done. What happened? Yeah. Open thoracotomy done in emergency room for an open cardiac massage. So any entry, sudden entry is always comes under contaminated. So yeah, it's a contaminated. Recurrent joint dislocation, skin hyperextensibility, and easy bruising. He has a genetic defect of COL5A1. Yeah, it's looking like Ehlers-Danlos. Yeah, and it's I am not sure about this question. We'll move to the next one. During laparoscopic surgery for a young male, after insufflating gas using Verey's needle, patient develops sudden bradycardia. So it is. I think this is due to vagal reflex due to peritoneal stretching. Hepatitis B immunization. Which of the following pattern is suggestive? So yeah, in a hepatitis B immune, only anti-HBs is positive. BIRATS 5 and IHC done. Luminal A. So luminal A is ER/PR positive and HER2 negative. So I don't see any option with ER/PR positive. We'll mark for review and see it later. Which of the following techniques is used to demonstrate this particular structure of amyloid? This is looking like an electron microscopy, the beta pleated sheet structure. So we'll go with electron microscopy. I have no idea about this Nottingham prognostic index. We'll skip to the next question. A 60-year-old male is brought to the emergency department. He had an injury on his back with multiple fractures. It was right hemisection of the spinal cord at T6 level. So it's Brown-Sequard syndrome. Which of the following would be present below the level of injury? So contralateral paralysis would be there. Yeah, a contralateral spastic paralysis. I think on left sided spastic paralysis would be there. A neonate present with jaundice. On doing a USG, a cystic lesion was found adjacent to the common bile duct. The image is shown below. What is the diagnosis? So yeah, it's looking like a choledochal cyst. Like from the history, a cystic lesion was found adjacent to the common bile duct, which is likely a choledochal cyst. Not a tumor suppressor gene. So we know P53, BRCA and RBR tumor suppressor gene. MYC is a signal transduction factor if I am not wrong. So the answer is MYC. A patient develops thyrotoxic crisis while operating for multinodular goiter with secondary toxicosis. The following all drugs are used except. So there is no use of diuretics in thyrotoxic crisis. Propanol is used to control the heart rate. There's Lugol's iodine and there is aspirin. There is no role of diuretic. So okay, so damage to which of the following artery supplying to internal capsule leads to hearing loss? So they are asking about the supply of the sublentiform part, uh, which I think it's anterior choroidal artery. Which of the following hypotheses that the physical and functional status of a certain region of genomic chromatin is dependent on the patterns of specific histone and post-translocation modification and or DNA methylation status? So yeah, this is the epigenetic code that the DNA can be changed with methylation. And they are asking about the transport media in case of a bacillary dysentery. So they're probably asking about Shigella dysentery. So it's buffered glycerol-saline media. This is flow cytometry and it's annexin 5 positive. Looks like it's annexin 5 positive. Yeah. So it's for apoptosis, I think annexin 5. A child was playing in the park. Suddenly, a dog came and jumped on him and started licking that child. Immediately, parents rushed to nearby hospital. Doctor advised clearing of area. So, I think this is primary prevention to prevent any disease. Identify the correct statement. Incorrect. The incorrect word is important. Related to clustered regularly interspaced palindromic sequence associated with gene 9. I think they are asking about caspases. It looks like from the option. We'll look at this question later. A 30-year-old woman presents for a routine eye examination. During the assessment, the optometrist performs a Maddox rod test to evaluate her binocular vision. The patient is asked to fixate on the light source while the Maddox rod is placed in front of the eye. She reports seeing a line of light displays right to the light source. What does this indicate? Right to the light source. So yeah, I think it's exophoria. Okay, so a child presents with proptosis, periorbital ecchymosis, biopsy reveals a neuroblastoma. What is the most likely location? So it's adrenal gland. Which of the following is most accurate about inverse agonism? It is easier to observe inverse agonism if there is sufficient constituted activity of receptor in the absence of agonist. This seems correct. Second option is inverse agonist has a higher affinity for active form of receptor as compared to inactive form. I'm not sure about this option. D is definitely not correct. They are antagonists. Yeah, we'll go with option A. We all are true regarding super antigens or except. So first is correct, second is correct. Enterococcus is not a super antigen, it's incorrect, and they cause release of cytokines. A female complains of a gradual loss of vision. She has drusense, and in the right eye, left eye appeared normal. So it's looking like it's ARMD because of drusense. All of the following, which of the following will not be blocked by atropine and scopolamine? So yeah, skeletal muscle contraction is because of the nicotinic, because of the NM receptor, acetylcholine, not muscarinic. So it's no use. Rheumatoid arthritis is associated with which of the following condition except? So it increases risk of lymphoma, of interstitial lung disease, of coronary artery disease. So I think the answer is gout. A study was done to assess malnutrition in young children. 100 children were selected, each from rural and urban area. Out of these, 30 among urban and 20 among rural were found to be. Which of the following statistical tests can be implemented? Okay, so they have divided them on the basis of rural and urban areas, which is a qualitative variable. So we'll go with chi-square test. A 67-year-old male presented to the emergency department with the history of consuming 20 beta blockers, excessive bradycardia, and decrease in cardiac output. Which of the following agents is least likely to be useful for treatment of beta blocker induced excessive bradycardia? So dopamine acts on alpha 1, beta 1, and D1 receptor. Dobutamine acts on beta 1 receptor, and glucagon is the drug of choice for beta blocker poisoning. So I'll go with phentolamine. Yeah, it's a blocker. Loss of sensation in front of thigh. On examination, it was seen that all loss sensation loss over the femoral triangle. Which of the following nerve is affected? In front of thigh, over the femoral triangle. It can be genitofemoral nerve. I don't think there is a nerve like medial cutaneous nerve. And genitofemoral nerve is a branch of. We'll go with genitofemoral nerve. Okay, so we are complete with section A. We'll just revise the questions which we have done from the question palette. From the first question itself, we'll start. For the intake of which acute migraine treatment, patient should be advised not to drive for 8 hours. I think whichever induces sleep, and I'm really not sure about this question, so we'll leave it. Second is we are sure about this. Most sensitive is asked, and it's procalcitonin. So up at the apical side, it looks like it's DMT1. Actually, I've forgotten this, which is apical, which is basal. I'm getting confused in that. Yeah, it's DMT1, I think. It, we'll check. Correct statement is asked in a 6-month-old. So yeah, all the 3 statements are incorrect. Rice mein, yeah, I think it's elevation. Omeprazole inhibits PPI. Now we'll go with TGF beta. IL-1 interferon interleukin 1 6 and TNF alpha similar. Hypothyroidism is a cause of delayed puberty. Small intestine secrete bicarbonate. Symptoms chorea we know. Which of the following transcription factor decrease in protein synthesis by inhibiting eukaryotic translation initiation factor and activation of caspase 3? I think they are asking about ubiquitin. Translation means inhibiting protein synthesis. But yeah, ubiquitin inhibits protein, causes protein degradation. I don't know. We'll leave it. I am not able to make a guess in this. This is cytokine release syndrome. That's PGA, GJ cell tumor, Purpose zoster. In the following image, 2 spheres have identical surface tension. They are not lined by surfactant. The clamp, if opened, what would be the consequence? You have identical surface tension. That's riboflavin. That's paranoid personality. The relaxed effect of vecuronium on the neuromuscular is augmented by adding a volatile anesthetic to a nitrous oxide because of a decrease in the relaxed effect of vecuronium on the neuromuscular system is augmented by adding a volatile anesthetic agent because of a decrease in release of acetylcholine. I don't know. I'm not sure. I'll go with D because it's not definite. It's not muscle blood flow. It looks like it's not release of acetylcholine. I think I'll go with D. See it, which is this incision. That's the 9 centimeter. That's the contaminated food. I think it's classical. I'm not sure. I don't remember. That's because of peritoneal. Yeah, it's correct. Uh, all these questions are seemingly correct. am not able to scroll it. What's wrong with it? Yeah, it's adrenal gland. Okay, this is correct. This is correct. This is tuitions. Yeah, it's correct. Okay, so I am done with my first reading. I Yeah, so I have marked 2 questions for review. I have not answered 7 questions, so I'll first answer those questions. I want to. Yeah, we'll mark this one. Yeah, so this question is about caspase, and we need to tell the incorrect options. Present in bacteria, it's correct. Help in modulating gene expression, it's correct. I think this is also correct. Maybe it's not acquired, it's natural because it's DNA directed nucleus. So because B and D is correct, so I need to take a guess between A and C. So I'll go with A. Maybe it's natural. This we are leaving. This we are leaving. I don't know. I'm not able to remember this one. I will go with, I think, Gibson incision, is it? I don't remember. It's not Kocher's incision. And it's at the back, retroperitoneum. We'll go with Maillard incision. I don't know what that is, but it's definitely not Kocher's. And doesn't seem like Gibson. We'll take a guess. Alright. So yeah, we'll leave 3 questions on this side. Nottingham prognostic index. The mitosis and grade look similar. I don't know. We'll leave this. Okay, so we'll leave 3 questions on this side. We can guess this actually because ubiquitin is a degradation molecule, right? So it doesn't inhibit synthesis, it degrades. So B and D is ruled out. And I think I have seen this word somewhere, so I'll go with this one. Yeah. I think we should leave this one because I'm really not sure which incision is this. Maybe Robson, I don't know. Let's guess it. Yeah, it's done. I don't know. Mitosis and grade look similar. Maybe lymph node is different. We can guess lymph node. Okay, it's done. Okay. A 26-year-old patient met with an accident and was brought to your hospital. He had abrasions all over his left hand and he was screaming. He has a toxic appearance. The patient did not allow you to touch his hands. SC imager. What is the most common organism? Cellulitis like कुछ लग रहा है ये. Uh, या cellulitis जैसा ही कुछ appearance आ रही है इसकी. या streptococcus. A 26-year-old man present to the emergency department with a chief complaint of palpitation for 3 hours. Blood pressure normal है, pulse बढ़ा हुआ है. ECG showed the picture compatible with WPW syndrome. Which of the following drug can be given is most appropriate? It's procainamide. We cannot give AV nodal blocking agents, right? A 40-year-old woman wakes up at 2 a.m. with a deep boring pain. Patient history reveals she has been suffering for SLE for the last year. B scan is shown below. What most likely diagnosis is? Okay, so I cannot judge by the B scan, but B scan is usually for retinal detachment or to see the posterior chamber. Yeah. Okay, so this is a classical history of adenomyomatosis because it shows a thickened junctional zone. A 60-year-old female with a history of congestive heart failure with mild hearing loss is given a diuretic as a part of standard care regime, along with digoxin and ACE inhibitor. During the course of treatment, she develops an EV conduction defect and is found to be hypomagnesemia. She has also worsened her hearing loss, which is so the hearing loss is worsened, so it might be a loop diuretic. It also correlates with the hypomagnesemia findings that magnesium is lost in the urine. So we'll go with furosemide. So it's diphtheria toxin. It's seen from the picture, it's diphtheria. And they are asking about the mechanism of action of diphtheria. So, so ADP ribosylation elongation factor. It's not CAM, it's not 60 years. A 59-year-old male presents with a AFib, AFib हो रखा है. His consulting physician digoxin prescribe करिए. Digoxin AFib को normal sinus rhythm में convert कर देता है. Which of the following mechanism is most likely responsible for this clinical effect? इसका parasympathetic effect होता है प्लस AV nodal block भी कराता है. Come straight, get internal. So yeah, it starts from cortex. It put in cortex and start with thymus. Planning of movement, right? So a female with PCOS come and we need to know the initial management. Her BMI is increased and she has excessive facial hair. So initially we'll do weight loss. A 3-year-old child is on predominant milk-based diet. His vegetable diet is low. B12 deficiency आ रही है, not expected पूछा है. तो माइक्रोवेलोसाइट्स आएंगे, मेगैलोब्लास्ट दिखेंगे अपन को, न्यूक्लियर साइटोप्लाज्मिक एसिंक्रोनी मिलेगी. MCHC एलिवेटेड नहीं होगा, MCV एलिवेटेड होगा. This is Kaposi sarcoma. Kaposi sarcoma virus is HHV8. HIV की हिस्ट्री है, टिपिकल वायलेशियस प्लेक्स दिख रहे हैं अपन को. So it's Kaposi sarcoma which is caused by HHV8. सिकल सेल एनीमिया की हिस्ट्री है, फीवर है 2 days, एपिसोड ऑफ सीजर हो रहा है, रनिंग हाई फीवर है, CNS एग्जामिनेशन करेंगे, इट इज पॉजिटिव है, कर्निक एंड ब्रुजिन्स्की साइन इज पॉजिटिव. Which of the following organism is most likely? So S. Pneumonia, probably. Meningitis, most common cause. 8 to 14 ट्रांसलोकेशन है, जॉ की स्वेलिंग है, तो बर्किट्स लिम्फोमा. HIV ड्यूरिंग विंडो पीरियड P44 काउंट P24 काउंट कराते हैं और कुछ ब्लड में आता नहीं. A 34-year-old pregnant female at 28-week gestation present with sudden painful bleeding. She has a history of hypertension. Her abdomen is tender and the uterus is firm. Fetal heart rate monitoring shows late deceleration. Most likely diagnosis is abruptio. क्योंकि पूरी हिस्ट्री से सारे फीचर्स क्लासिकल अब्रप्शियो की तरफ जा रहे हैं. टेंस टेंडर है, हाइपरटेंशन की हिस्ट्री, पेनफुल ब्लीडिंग हो रही है. नाइट स्वेट्स फीवर, टीबी की हिस्ट्री है, 10 kg का लॉस हो गया है. हार्ट रेट, रेस्पिरेटरी रेट, स्प्यूटम अपन ने सीवी नेट में करी, थ्रू पूछा है सीवी नेट के बारे में, तो 6 सही है. रिफैम्पिसिन सेंसिटिविटी डिटेक्ट करता है, एंटीबॉडीज डिटेक्ट नहीं करता, 4th गलत है. तो 6 और 4 दो ऑप्शन में आ रहा है और इसमें 6 आ रहा है, तो प्रोबेबली इसका आंसर 136 है. एक बार देख लेते हैं 136 सही है. थर्ड आरटीपीसीआर होता है, लोएस्ट टर्न अराउंड टाइम होता है, तो करेक्ट है सारे ऑप्शन, टू स्टेटमेंट्स. आइडेंटिफाई द करेक्ट जीन क्वेश्चन. अच्छा, तो लैक ओपेरॉन का एक स्टेटमेंट है, ZY region is maximally expressed during presence of glucose and lactose. Glucose की presence में lac operon express नहीं होता. In the absence of glucose, CAM binds with CAP at CAP site and initiates transcription of promoter site. सही है, ठीक है. लैक जीन इज अ रेगुलेटरी जीन, ये भी सही है. तो ए वाले तो कट गए ऑप्शन और सी अपना डेफिनेटली करेक्ट है. तो अब बी का देखना है अपन को. इन द एब्सेंस ऑफ ग्लूकोज, CAM binds with CAP site at CAP site. ठीक है, तो ये सही लग रहा है. तो ब्लू आईज है, माइनर इंजरी हुई है लेग के अंदर, मल्टीपल फ्रैक्चर्स आ रहे हैं, सिमिलर हिस्ट्री ब्रदर के अंदर है मल्टीपल फ्रैक्चर की, तो ये अपनी ऑस्टियोजेनेसिस इम्परफेक्टा की तरफ जा रहा है. Zebra bodies is a pathological hallmark of Fabry's disease. A 60-year-old alcoholic presents with the emergency room with red currant jelly sputum and a bulging fissure sign. और अपन से पूछा है bulging fissure sign Klebsiella pneumonia की तरफ जा रहा है. तो Klebsiella pneumonia लैक्टोज फर्मेंटिंग होता है या नॉन लैक्टोज फर्मेंटिंग होता है, तो इट इज लैक्टोज फर्मेंटिंग. आई थिंक इट्स नॉन मोटाइल एंड लैक्टोज फर्मेंटिंग, आई एम नॉट श्योर, मुझे जहां तक याद आ रहा है इट्स नॉन मोटाइल, डेफिनेटली लैक्टोज फर्मेंटिंग. या नेक्स्ट क्वेश्चन. ग्रेजुअली सडन ड्रॉप इन ECO2 हो रहा है. जनरल एनेस्थीसिया लिया ड्यूरिंग डायग्नोस्टिक लैप्रोस्कोपी, CO2 insufficient, or SpO2 decreases from 99% to 90%, and अच्छा PCO2 इंक्रीज हो रहा है, अपना सडन इंक्रीज इन PCO2 हो रहा है. हिस्ट्री से क्या लग रहा है? सडन ड्रॉप हो रहा है, एयर एम्बोलिज्म हो सकता है। इट कैन बी एयर एम्बोलिज्म, सडन ड्रॉप हो रहा है। CO2 से इंसफिशिएशन भी किया है, रिव्यू कर लेते हैं फिर देख लेंगे। हंटिंगटन डिजीज, कैग, विच अमीनो एसिड इज इन्वॉल्व? कैग का कौन सा अमीनो एसिड है ये मेरे को पता नहीं है, कैग कौन कोड करता है। नेक्स्ट क्वेश्चन देखते हैं, गेस करेंगे। A 33-year-old chronic alcoholic presents with pain and deformity in his right hip. फ्लैटनिंग ऑफ फेमोरल हेड हो रहा है, ये वैस्कुलर नेक्रोसिस लग रहा है। ठीक है, सेकंड तो करेक्ट है। टॉम स्मिथ आर्थराइटिस तो बच्चों में होता है, जहाँ तक मुझे याद आ रहा है। आई थिंक आई गो विद 1 2 3। मीडियल स्ट्रेबिस्मस, लेटरल रेक्टस को कौन सप्लाई करता है? सिक्स नर्व, सिक्स नर्व यानी कौन सी? एब्ड्यूसन। फेलियर टू थ्राइव, इंटेलेक्चुअल डिसेबिलिटी, डेवलपमेंटल डिले, माइक्रोसेफेली। मस्टी ऑर्डर है और हाई ऑर्डर ऑफ फिनाइल लैक्टेट है, तो फिनाइल कीटोन यूरिया है, फिनाइल एलेनिन हाइड्रोक्सिलेज की डेफिशिएंसी। स्पेयर कर रहा है पाम्स एंड सोल्स को, नो हिस्ट्री ऑफ एनिमल एक्सपोजर है, मतलब एनिमल एक्सपोजर की कुछ भी हिस्ट्री नहीं है। एपिडेमिक ट्राइपस, ये लाउस बॉन्ड होता है। एपिडेमिक, एंडेमिक जो होता है फ्ली होता है, माइट होता ही है, हार्टिक होता है। सब में एनिमल एक्सपोजर की हिस्ट्री आ रही है। We'll see. Branches of external carotid artery except inferior thyroid artery नहीं होती। Recurrent oral ulceration, no other systems. Posterior uveitis है, yes, painful erythematous regions on anterior shins. So yeah, it's Behcet's recurrent oral ulceration along with uveitis. World keratopathy is seen in amiodarone. A 23-year-old female presents with primary amenorrhea. She has normal secondary sexual characters and normal height. Blind engine vagina है, यूट्रस भी एब्सेंट है, ओवरीज नॉर्मल है। नॉर्मल ओवरीज है तो टर्नर सिंड्रोम रूल आउट हो गया, एंड्रोजन इनसेंसिटिविटी हो गया, MRKH सिंड्रोम है, ओवरीज नॉर्मल है। choking sensation and is unable to speak. Immediately तो अपन लिख लेने वाले हैं। जापानीज एंसेफेलाइटिस एरिया से आया है, हिस्ट्री ऑफ कन्वल्जन है, अपन ने डायग्नोसिस बना लिया है। तो क्या गलत है? एग्जाम्पलीफायर है, राइस पैडी फील्ड सही है, क्यूलिक्स मॉस्किटो सही है, एडीज मॉस्किटो गलत है। 3 consecutive फर्स्ट ट्राइमेस्टर मिसकैरेजेस है, रिकरेंट प्रेगनेंसी लॉस के लिए अपन इवेल्युएट कर रहे हैं। पर लेबोरेटरी रिजल्ट शोज एलिवेटेड एंटीकार्डियोलेपिन एंटीबॉडीज, तो अपला है ये, अपला में अपन एस्पिरिन प्लस LMW करेंगे। A 2-year-old infant is brought to the hospital, normal growth curve है, फर्स्ट डोज अपन ने हेपेटाइटिस की दे दी है, हेप IG भी दे दी है। अब 2 मंथ ओल्ड आ रही है यानी 8 वीक्स। विटामिन ए वाला ऑप्शन गलत है, जापानीज एंसेफेलाइटिस वाला ऑप्शन गलत है। अपन को ए और सी में से चूज करना है। ए भी अपन एमएमआर इतनी जल्दी क्यों देंगे? और 32 ईयर्स की फीमेल है, ओवेरियन सिस्ट है, यूनिलॉक्यूलर है, बिनाइन लग रहा है, विथ थिन वॉल्स, नो सॉलिड कॉम्पोनेंट। तो अपन फॉलो अप करेंगे। 4 सेंटीमीटर का, ज्यादा बड़ा भी नहीं है। NSTMI हुआ है, MR हो गया है उसको, पर ऑक्सीजन सैचुरेशन इज वेरी लो। विच arteries involved in a myocardial infarction? Acute shortness of breath है 7 days after NSTMI. She has chest pain. Her oxygen saturation is 78%. आई थिंक अपन एलईडी कर देते हैं फिर बीच में एक बार। सबसे कॉमन आर्टरी एलईडी इन्वॉल्व हो रही है, इससे ज़्यादा पता नहीं चल रहा। Fetal heart rate shows variable deceleration. On examination, the patient is in transverse line. Cord compression की वजह से वेरिएबल डेसिलेशन आ रहे हैं। फीटस ट्रांसवर्स लाइन में है। अपन अब इसमें वेजाइनल डिलीवरी तो कर नहीं सकते, ऑक्सीटोसिन इंडक्शन का कोई मतलब नहीं है। या तो सिजेरियन करो या एक्सटर्नल सेफेलिक वर्जन करो, पर अब वो लेबर के अंदर ही आ गई है, तो अपन सिजेरियन सेक्शन में करते हैं। आशा प्रेजेंट करती है RK39। RK39 किसके लिए होता है? लेशमीनिया के लिए। तो इट्स द प्रोबेबल डायग्नोसिस। क्या हो गया है? हाँ, एज अ हिस्ट्री एंड एज अ कोफ्ट। कोफ्ट पैटर्न, कोफ्ट क्लासिकल वर्ड है। B2 B3 में कोविंग दिख रही है, तो ब्रुगाडा सिंड्रोम। न्यू मोडालिटी आई है कीमोथेरेपी की, बेटर रिजल्ट है और पी वैल्यू उसकी 0.03 है, तो 0.05 होती है। इसका मतलब है कि न्यू ड्रग इज मोर इफेक्टिव, क्योंकि पी वैल्यू 0.05 से कम है, नल हाइपोथेसिस। All of the following scenarios warrant extensive evaluation of headache etiology except। अब इसमें टेम्पोरल टेंडरनेस सही है, फर्स्ट ऑनसेट 50 भी सही है, सब एक्यूट प्रोग्रेशन भी सही है, पर कोकेन यूज में तो अपन को पता है नहीं etiology। फीवर एंड चिल, लूज लाउस बाउट की हिस्ट्री है, तो इसमें से लाउस कौन सा होता है? एपिडेमिक टाइपस। एलिवेटेड जीवीपी है, एब्सेंट ब्रेथ साउंड्स है, लेफ्ट हेमीथोरैक्स है, एपेक्स बीट is shifted to the right, hyper resonant percussion over the left hemithorax। हाइपर रेजोनेंट है तो टेंशन न्यूमोथोरैक्स हो सकता है। लेफ्ट हेमीथोरैक्स में एब्सेंट। या सो इट्स टेंशन न्यूमोथोरैक्स, क्योंकि प्रीवियस कहाँ से जाता है? एक सेकंड, कुछ दिक्कत हो रही है। एम्फाइसीमा नहीं है, अरे थोड़ा सॉरी, ये टेंशन नहीं हो रहा है। A present with women present with vaginal discharge and strawberry cervix दिख रही है। स्ट्रॉबेरी सर्विक्स में मोस्ट लाइकली डायग्नोसिस है ट्राइकोमोनियासिस। फिर ये तो क्लासिकल एमएस की पिक्चर है, डॉर्सन फिंगर्स दिख रही है अपन को, ऑन एंड ऑफ हिस्ट्री। आइडेंटिफाई द कॉज ऑफ यूरेथ्राइटिस, तो गोनोकोकल यूरेथ्राइटिस है अपन को, बैसिला दिख रहा है। जी या ए इज द आंसर। फिस्ट फाइट हो रहा है, स्वेलिंग हो रहा है, संकिन आई साइन मिल रहा है, एंड देयर इज पेरी ऑर्बिटल एक्काइमोसिस। इंफीरियर रेक्टस अपनी ट्रैप हो गई है, इसके अपवर्ड मूवमेंट नहीं हो पा रहा है, तो ऑर्बिटल फ्लोर का फ्रैक्चर है ये। Ruloxitinib has been approved for atopic dermatitis, psoriasis, non-segmental vitiligo, and acute graft versus host disease. यूजुअली ऐसे क्वेश्चन में मैं जिसमें गेस, वैसे इसको छोड़ देते हैं, बाद में इसको अटेम्प्ट करते हैं। नॉन रिड्यूसिबल स्वेलिंग प्रेजेंट है लेटरल टू प्यूबिक ट्यूबरकल, ठीक है। व्हाट इज योर डायग्नोसिस? ऑब्स्ट्रक्शन ही हो रखा है, तो इट्स अ स्ट्रैंगुलेटेड इनडायरेक्ट। बीएनएस मेरे को याद नहीं है, गेस भी नहीं मार सकते, तो ये छोड़ेंगे। इसमें अनअटेम्प्टेड क्वेश्चन एक बार देख लेते हैं। डीप बोरिंग पेन हो रहा है, एसएलई से सफर वो कर रही है फ्रॉम द लास्ट ईयर, बी स्कैन इज शोन बिलो, व्हाट इज योर डायग्नोसिस? तो अपन एंटीरियर यूवेइटिस कर देते हैं, एसएलई के साथ वही जा रहे हो, बी स्कैन पे दिख रही है। या तो वी लीव दिस, कैग मुझे पता नहीं किसको कोट करता है, बट वी कैन वी कैन गेस ग्लूटामेट में भी, क्योंकि ग्लूटामेट एक न्यूरोट्रांसमीटर भी होता है, या ग्लूटामेट गेस करते हैं। बाकी का कुछ आइडिया नहीं है, तो बेस्ट ऑप्शन ग्लूटामेट, ग्लूटामीन में से ग्लूटामेट ही लगेगा। रैशेज हो रहे हैं ऑल ओवर द बॉडी, स्पेयरिंग palms एंड soles, नो हिस्ट्री ऑफ एनिमल एक्सपोजर। इसमें ऑल सेलेक्ट कर लेते हैं, छोड़ देते हैं। एलईडी ही मोस्ट कॉमन है अपन। Yeah, excellent. In case of fracture of humerus, there is a chance to all of the structures except axillary nerve can be damaged, brachial artery is damaged in supracondylar fracture of humerus, axillary artery is damaged, so axillary artery, median condyle fracture, it's axillary artery, I think. या मीडियन कंडाइल जाएगा फ्रैक्चर में मीडियन ऑफ डैमेज हो जाएगा लेटरल कंडाइल या इट्स एक्सिलरी पैन सिस्टोलिक मर्मर है ये पैन सिस्टोलिक मर्मर मिट्रल रिगर्जिटेशन में मिलती है और ट्राइकस्पिड रिगर्जिटेशन में मिलती है लेफ्ट स्टर्नल बॉर्डर इज ट्राइकस्पिड रिगर्जिटेशन मिट्रल रिगर्जिटेशन की जो मर्मर होगी वो एपेक्स में होनी चाहिए कैन वॉक होल्डिंग ऑन टू फर्नीचर सिट विद सपोर्ट ठीक है she uses a neat pincer grasp to pick up a pen and she can release a cube into a cup after it has been demonstrated. She tries to build a tower of two cubes. What is the developmental age? Two 2 years. Classical sign in the given below and choose the correct option. So it's a GCT. Axial cracking दिखता है. May show malignant potential सही है. 2-3 सही है. Age group गलत है. 2-3. This is looking like a orchidometer to me. Yeah, it looks like an orchidometer, Paddy's orchidometer. Child is noticed 10 to 20-second lapse in consciousness, cloning movement as face. His parents have not noticed this behavior at home. Absent seizures है, most appropriate treatment पूछा है. EVL होता है इसमें, इथोसक्समाइड, वैल्प्रोएट और लैमोट्रिजिन. तो इथोसक्समाइड है नहीं ऑप्शन के अंदर, तो वैल्प्रोएट एसिड. नेजल डिस्चार्ज की हिस्ट्री है. SARS कोविड आ रहा है इसके अंदर, SARS कोरोना वायरस. Which of the following sets of findings best describes the virus? So DNA नहीं, RNA वायरस है, SSRNA. इन्फ्लुएंजा लाइक वायरस है, SSRNA हो गया. DSRNA सिर्फ एक ही वायरस होता है, SSRNA. लोअर abdominal पेन है, फीवर है, पुरुलेंट वेजाइनल डिस्चार्ज है, मल्टीपल सेक्सुअल पार्टनर्स की हिस्ट्री है, डज नॉट यूज contraception regularly. On examination, she has cervical motion tenderness, elevated blood count. pelvic ultrasound पे 5 सेंटीमीटर का complex adnexal mass with thick septumtions and internal echoes. Looks like an PID. I think it's a tubuloovarian abscess. Ectopic pregnancy नहीं है क्योंकि purulent vaginal discharge, cervical motion tenderness, elevated blood count सब infection की तरफ point कर रहा है. Infant develops bilious vomiting, 1 day old infant है, it is just after birth. तो ये duodenal atresia की तरफ जाना है. Initial management पूछा है. Initial management. We'll see later. Ubiquitin proteasome system is associated with functional ubiquitin increases chances of misfolded, ये गलत है. Proteasome activators are used in cancer therapy, ये सही है. Mark damage or misfolded proteins for destruction through process of ubiquitination. C और D दोनों ही सही लग रहा है. नीमोसिस्टिस दिख रहे हैं तो HIV पॉजिटिव की भी हिस्ट्री है. बाल फ्लूइड पे अपन को दिख रहा है नीमोसिस्टिस की अपीयरेंस. इलेक्ट्रॉन ट्रांसपोर्ट चेन स्टार्टिंग फ्रॉम NADH. तो फर्स्ट टू फोर्थ तो अपन को पता ही है. फिर 4231 ऑर्डर होगा इसका. 4231. फीमेल आ रही है CIN ग्रेड 3. एसिम्प्टोमेटिक है. HCl दिख रहा है उसके. कॉल्पोस्कोपी करी अपन ने तो अपन को एक लीजन दिख रहा है इन्वॉल्विंग द एंडोसर्वाइकल कैनाल विथ अनसैटिस्फैक्टरी विजुअलाइजेशन. HCl है, लीजन दिख रहा है अपन को, तो अपन को लीप करनी चाहिए. फीवर, हेडेक एंड रैश है. एस्कार दिख रहा है. रीसेंट ट्रिप है साउथ ईस्ट एशिया पे. रिकेट्सल इन्फेक्शन आ रहा है. विच ऑफ द फॉलोइंग इज द कॉजेटिव एजेंट पूछा है अपन को, तो अपन को इसमें पता है ओरेंशिया सूसू. स्क्रब टाइप. स्क्रब टाइफस है. स्क्रब वेजिटेशन लिखा है. Which money expenditure is compared with result outcome. तो कॉस्ट बेनिफिट हुआ ये. कॉस्ट इफेक्टिव में ह्यूमन लाइफ कंपेयर करते हैं. 7 days postpartum with fever, lower abdominal pain and foul smelling lochia. On examination she has uterine tenderness. तो ये foul smelling lochia usually sepsis की तरफ काउंट करता है. मास्टाइटिस गलत है. UTI गलत है. I'll go with endometritis, postpartum endometritis. ठीक है, ये अपन को दिख रहा है क्लियरली. इसके अंदर टर्मिनल स्पाइन है, तो शिस्टोसोमा हेमाटोबियम है ये. टोटल थैरेक्टोमी है. स्ट्राइडर है. रेस्पिरेटरी डिफिकल्टी है. ट्रेकियोस्टोमी करनी पड़ेगी. बायलैटरल रिकरेंट लैरिंजियल नर्व इंजरी है. A 34-year-old woman undergoes a NIPT at 12 years और हाई रिस्क आई है ट्राइजोमी के लिए. She is anxious and wants to confirm the diagnosis. कंफर्म करना है उसको, तो अपन CVS करेंगे. उसको कंफर्म करनी है डायग्नोसिस. Bile duct injury, injury of blood vessels in the hilum is given the name. I think so. With blood vessel injury, might be Hanover. I'm not sure. But बिस्मथ में तो ब्लड वेसल्स का नहीं आता है, वो तो हाइलम की इंजरी होती है. Let's guess this. On occasion of International Millet Year 2023, we are preparing a report to present to the government showing comparison ऑफ न्यूट्रिटिव वैल्यू ऑफ वेरियस मिलेट्स। तो अपन वेरियस मिलेट्स की वैल्यू को कंपेयर कर रहे हैं। हिस्टोग्राम, क्योंकि बार चार्ट तो क्वालिटेटिव डेटा के लिए होता है, तो पाई चार्ट गलत है, पिक्टोग्राम गलत है। एक बार रिव्यू कर लेंगे पूरा क्वेश्चन। A 45-year-old woman presents with severe burning pain in her right foot followed by a trivial injury. The pain is associated with swelling, increased sweating, and increased temperature. On examination, there is allodynia, hyperalgesia, and skin color changes. Which of the following pathological mechanisms is contributed to this? I think ये overactivation of sympathetic system probably. हिली एरिया की हिस्ट्री है, नेक स्वेलिंग है, कॉन्स्टिपेशन है, फटीग है, आयोडीन डेफिशिएंसी क्लासिकल। Which of the following receptors are activated by menthol? क्रूट्स-फेल्स जैकब डिजीज में 1433 प्रोटीन डिटेक्ट करता है। Which of the following receptor relieves magnesium block in long-term potentiation in memory and learning mechanism? No idea. पेनफुल रेड आई है, इडिमेटस कॉर्निया है, शैलो एंटीरियर चेम्बर है। टेकोमॉर्फिक ग्लूकोमा। क्विंजी है ये, टॉन्सिलर एब्सेस दिख रहा है ये, पैराफेरेंजियल में बाहर की स्वेलिंग होगी। A 33-year-old woman is evaluated for recurrent episodes of severe repetitive burning right head and is associated with ipsilateral conjunctival injection, tearing, and photophobia. Cluster headache type है ये। Which of the treatment is most likely to be effective? Right forehead and temple. संस्थिति भी हो सकता है। मेरा ठीक है नहीं करेंगे। Pressure support ventilation, which is true. Delivers a specified volume. No, delivers a specified pressure. Does not increase the. I think it's A. I'll guess that. Laparoscopic cholecystectomy करी, invading the muscularis propria. अब अपन क्या करेंगे फर्दर? रेडिकल हटा देंगे। Which of the following decreases the MAC of, यानी इंक्रीज करता है पोटेंसी? जस्ट अ सेकंड। increases the MAC of isoflurane? I don't remember this order actually. C. Autoimmune disorder, redness on the orthopedic के पास है drug induced osteoporosis. Which of the following which of the following mechanism is accurately associated with development of osteoporosis? इनहिबिट अब्जॉर्प्शन ऑफ कैल्शियम से तो नहीं होगा, डिप्रेस करता है हाइपोथैलेमो पिट्यूटरी एक्सिस को, और प्रोस्टाग्लैंडिन से क्या लेना, तो विल प्रोबेबली गो विद ए. रॉन्ग पूछा है एसएलई में. एसएलई में एंटी स्टोन सही है, एंटी न्यूरोनल सही है, मोस्ट स्पेसिफिक होती है एंटी स्मिथ. इंक्रीज कब टू डिस्क रेशियो मिलेगा अपन को? रिस्क फैक्टर्स पूछे हैं. पॉलिप इतना छोटा रिस्क फैक्टर नहीं होगा. सिंथेटिक एंड्रोजन से एक्टिवेट करेंगे. जीपीसीआर को नहीं करेंगे, मस्करेनिक को नहीं करेंगे, टायरोसिन करेंगे. For HIV diagnosis and testing in clinically symptomatic individual, retesting after 14 to 28 days is recommended by NACO in which of the following conditions? P1 पॉजिटिव है, P2 पॉजिटिव तो टेस्ट खत्म है. ये तो टेस्ट ही खत्म है, ये भी टेस्ट खत्म है, इसमें करेंगे. कार्बोक्सी में OPV में suddenly noticed that the color of the inner square of the vaccine vial monitor was dark purple. डिस्कार्ड कर देंगे जब कलर डार्क हो जाता है अंदर. All of the following are causes of central cyanosis except high altitude, hypothermia, pulmonary AV fistula and with hemoglobin. Hypothermia central cyanosis कराएगा. False regarding type 1 में पूछा है. Anomalous junction दिखता है, most common type होता है. 2 and Y करते हैं इसके अंदर type 1. Competency और FN. 2D standard verb होता है, Morrison's कफ इन्फ्लक्स होता है. 241. Patient with severe systemic disease that is a constant threat to life. Pause recording iris. I don't think ART should be strong. Acute gouty arthritis सही है, डबल काउंटर साइन मिलता है. Erosions with martel साइन मिलता है ये. Population indicator इसमें से कौन सा नहीं है? Dependency ratio, sex ratio, population density. Beta oxidation mitochondria में होता है. Fatty acid need to be converted. ठीक है. Unattempted question देख लेते हैं. A child can walk holding on to furniture. तो walk अगर वो कर रहा है तो एटलीस्ट 8 मंथ से ज़्यादा का वो है. I'll go with 9 months. Duodenal atresia में इनिशियल मैनेजमेंट क्या होता है? Insertion of a rectal tube for decompression, placement of nasogastric tube and initiation of IV fluid therapy, and using gastrointestinal radiographic series to look for malrotated. इनिशियली तो यही करेंगे आई थिंक. नहीं पहले ये करेंगे. There is no gastric deep distension. अच्छा. पहले एक्सरे करके फिर रूल आउट करेंगे क्या. Ubiquitin proteasome system is associated with comparison of nutritive value of various millets. Nutritive value. नो आइडिया इसका मेंथॉल का। अल्जाइमर्स में अपन एंटी एनएमडीए देते हैं। तो कर सकते हैं इसको ऐसा सोच के कि एंटी एनएमडीए देते हैं तो एनएमडीए रिसेप्टर्स का रोल है। primary survey includes all of the following. So definitely not NCCT. We cannot do any investigations, ET tube chest X-ray, and intercostal drainage. Yeah, so I'll go with 1, 2, and 4. ए डायनेमिक बोन डिजीज का कॉज क्या होता है? सेकेंडरी हाइपरपैराथायरॉयडिज्म. सेकेंडरी हाइपर सीवियर कैल्सिफिक मिट्री सिनोसिस है, लेफ्ट एट्रिया में थ्रोम्बस है, ए फिब पर है. हु इज ऑन वॉरफेरिन. बेस्ट मैनेजमेंट क्या है? कुमार 40-year-old मेल was stabbed in the chest. बीपी कम है, पल्स रेट बढ़ रही है, एक्सरे में अपन को दिख रहा है. व्हाट इज द डायग्नोसिस? इट मस्ट बी हीमोथोरैक्स. वाइट कलर की ओपेसिटी दिख रही है, कैन नॉट बी हीमोथोरैक्स. प्लूरल एफ्यूजन हिस्ट्री से मैच नहीं करता. स्टैबिंग की हिस्ट्री है तो इट्स हीमोथोरैक्स. Pulmonologist is evaluating a patient with respiratory symptoms and is considering various mycobacterial infections. Which of the following statements correctly? Wrong मैच बताना है. फॉल्स पूछा एलर्जिक ब्रोंकोपल्मोनरी एस्परजिलोसिस के. ये ट्रू है, सही है. सेंट्रल ब्रोंकिक्टेसिस होती है. टीएलडी होता है, टीएलडी बैच. रोड ट्रैफिक एक्सीडेंट है. क्रेप बैंडेज. इनएडिक्वेट इमोबिलाइजेशन. मोस्ट लाइकली कॉज ऑफ नॉन. प्रोसीजर है, बेयर्स ब्लॉक है. नॉट पूछा है इसके अंदर, तो ब्यूपेरिन यूज नहीं करते बेयर्स ब्लॉक के अंदर. एडेमेंशियोमा नॉट रेलेवेंट पूछा है. विनाइन ट्यूमर, फॉलन लीव इसमें नहीं होता. थर्ड गलत है. फाइब्रस ट्यूमर. वन एंड बेरियम सैलो पे अपन को weight loss, old food regurgitation, and halitosis. What is the diagnosis दिख रहा है अपन को? ब्लैक ब्लैक कलर के अपन को मेटाबोलाइट्स दिख रहा है. इक्योमेडेट. रिकरेंट एपिसोड्स ऑफ ब्लीडिंग हो रही है. नॉर्मल पीटी है. मिच कहाँ है? CPT1 हाई लेवल इनहिबिट करते हैं. A sorbic acid can enhance the absorption of oral iron. सही है, ये भी सही है, ये भी सही है. Annular lesions are seen in all of the following except the arteria में annular lesions नहीं मिलते. Whiplash injury, hyperextension followed by hyperflexion. Hyperextension important है. First होगा इसके अंदर, first तो होगा ही. The most effective method for motivating a couple to adopt family planning practices is interpersonal communication. A young male who is a user of black tar heroin presents with descending paralysis overuse. So descending, तो ये botulinum की तरफ जा रहे हैं descending paralysis. Mature teratoma है, अपन को सारी findings दिख रही हैं इसके अंदर. Teeth, weed, बाल. We'll go with mature teratoma. Identify the given structure. A dialysis clears autoantibodies from the myelin. It is based on semi-permeable membrane. Rate of dialysis कौन decrease करता है? Thickness membrane region. Foramen lacerum. Copper T is classical with actinomycosis. उसकी क्या अपन करेंगे? Penicillin. The chief flexor of hip joints. Chief flexor श्वास होती है, पीली श्वास. ये है falling leaf sign, simple bone cyst. Sickle cell have low osmotic fragility and high mechanical fragility. Rocky Mountain spotted fever का लास्ट पूछा है, इससे ही समझ आ रहा है तो रिपीट से कराते हैं. इतने सारे अपन को न्यूट्रोफिल्स दिख रहे हैं इसके अंदर एमआई के अंदर. Molluscum contagious and obligated package लिखना है. Cahill cycle is for alanine. RPGN मिल रहा है renal vacuum में necrotizing crescentic glomerulonephritis है. तो ये अपना जा रहा है वेगनस की तरफ. Slapstick है. Slapstick appearance है. It is parvovirus. Not true question, not true. तो कावासाकी तो यंग एज ग्रुप का होता है. इम्यूनो कॉम्प्रोमाइज में मेनिंजाइटिस कौन करता है? आई थिंक क्रिप्टोकोकोसिस ही पढ़ते हैं मेनिंजाइटिस में, तो अपन सबसे कॉमनली asthmatic attack आ रहा है. The patient has been suffering from seasonal asthma. On history taking, he reported that he took 2 aspirin tablets previous evening. Oral aspirin. 922 translocation है. Splenomegaly है. It's probably CML. अपन फिश करेंगे. Intravenous. I think alendronate है जो intravenous अपने लिखा है. Alendronate, yes. This is hairy cell leukemia. Yeah. I mean, LCH Langer and suggested. Rash since last day, 1 day. Day 4 पे rash आया तो. This is orange tonsil. Law of Laplace is an important. Which of the following organ follows this law? तो सारे follow करते हैं, specifically urinary. Tachycardia है. याद नहीं है. Better to leave it.
Hello. Hello. Thanks a lot, Dr. Ayushi, on
Yeah,
spending time after huge success on securing All India rank 69 and spending time, teaching your juniors, future aspirants on how to prepare for their examination, sharing tips on how to attempt the examination. Uh, we thank you a
thank
lot
you, sir.
for doing this with Dr. Tutorials. Thanks a lot. And we wish you very all the best for your
Thank you,
success
sir.
and for your journey from here. Thank you. Thanks a lot.
Thank you. Should I stop sharing the screen?
Yes, yes, yes. Thank you.